All right, I'm Hannah Gerard, and I'll be doing an adult assessment, head to toe assessment on my husband Nate. Things we've already done are the past medical history. We've done vital signs. We've done the Snellen eye chart, which is cranial nerve number 2, and we've done weight, height, and we've assessed mental status. And now I'm going to do alert and orientation questions. Can you tell me your full name and date of birth?
Nate Broomhall, March 2nd, 2000.
Perfect. Can you tell me what year it is?
2023.
Can you tell me where you're at right now?
Our house.
And can you tell me what we're doing?
Assessment.
Good. Okay. And then we'll start out with the cranial nerves 1 through 12, except for we already did number 2, the Snellen. So the first one is smell. So I'm going to have you occlude one of your nostrils and close your eyes. And I'm going to just ask what you smell.
Alcohol.
Good. And then the other one. And then what is this?
Orange.
Yeah. Yep, perfect. Okay. And number 2 we already did, like I said. And then we're going to test, you can be done now. We're going to do number 3, 4, and 6. And so that has to do with your face. So I'm going to have you raise your eyelids. Good. I'm going to have you follow my finger, but don't move your head. These are testing the cardinal movements. Good. Okay, and then I'm going to check your pupils, equal, round, reactive to light, and accommodation. Good. They're equal and round. They're accommodating. And the way you test accommodation, I want you to look right here. And then, no, look right here. And I'm going to have you look at my pen light. And look right here. Good. The pupils are constricting, they're accommodating. So that's good. That's 3, 4, and 6. And then I'm going to do 5 and 7. I'm going to have you puff out your cheeks. I'm going to have you bite down. I'm going to bite down to quit puffing out your cheeks. I'm going to feel his jaw for any TMJ. I'm going to have you wrinkle your forehead. Raise your eyebrows, wrinkle your forehead, close your eyes. Okay, and then I'm going to have you put your hand out. And you're just going to tell me if the sensation is sharp or dull. So close your eyes.
Sharp.
Good.
Dull.
Good. Okay, next is number 8, and it's hearing. And the only way I think to do that, so plug one ear. I'm going to whisper something, and you just repeat it.
4.
Okay, other side.
2.
Good. And then number 9, 10, and 12, and it has to do with your mouth. So I'm gonna have you put your tongue out. Good. And then press it on your cheek. Good. This side. Good. And then I would use a tongue depressor to check his gag reflex. I'm gonna have him open up his mouth and say ah.
Ah.
Good. And then I would have him take a drink of water. So pretend to take a drink of water, and I'm making sure he can swallow. I'm kind of checking his neck there. And then also, while he was opening his mouth, I'm checking his mucous membranes, I'm checking his teeth, for cavities, I'm checking his gums, I'm checking his tonsils and his pharynx and uvula. I'm checking everything in his mouth, his gums as well. And then I'm going to have number 11, shrug your shoulders for me. Good, and then push your head on my hand. Perfect. Okay, next thing we're gonna do is test your balance, cerebellum. So I want you to do alternate hand movements. Good. I want you to do one at a time. Good. Good. And then I want you to touch all your fingers to your thumbs on both hands. And then I want you to touch your arms out. Good. And then I'm actually gonna do some of the standing. Close your eyes and hold out your hand. Just checking your tactile. What is that? Sterognosis. So what is good? That's a coin. Good. And then graphesthesia, I think is how you say it. Tell me what I'm writing.
Z.
Perfect. Okay, and then I'm gonna have you stand up. And this is kind of like Romberg. Oh, it's kind of hard to see, so step back a little bit. Yeah, there we go. Okay. Stop. Okay, come right here. There you go, that's fine. Okay, then I'm gonna want you to close your eyes. Just kind of checking his balance. I want you to lift up one foot at a time. Good. Other foot. And then I want you to run the back of your heel down in front of your shin. Close your eyes. Good. And then I want you to walk on your heels to your toes and then stand on your toes. Good, and then go like heel toe. Okay. And I think we're good, so I think you can sit back down. Okay, we did it with his eyes open and his eyes closed. Next, we're gonna do his head, skin, hair, eyes, ears, nose. We kind of already did the mouth, then we'll do the neck. So his head, I'm looking for bumps, lumps, and bruises. His skin, I'm checking. I'm just looking at like the elasticity, the turgor. It's warm. And then I'm checking his hair for any like hair loss, tenderness. I'm checking for distribution of his hair. And then his ears, I would use like an otoscope and I would look at his eardrums and I would be able to see gray and shiny. And then I'm looking at his oracle, just making sure there's no pain, just looking for any abnormalities. Look on this side as well. Looking in his ear canal. Then his nose, I'd use a speculum and I'd have him look up. I'm looking for septal deviation, which you do have. Looking for any drainage. I'm looking at the mucous membranes. And then as far as his neck goes, I'm looking for symmetry. I'm looking at his lymph nodes. I can feel a carotid pulse on both sides. We kind of already checked his like swallowing, and then I would listen for any bruise with the bell of my stethoscope. Okay, and then after that, we've kind of done all of that. Next, I will listen to his lungs and his heart. And so I would listen across all 7 spots all the way down, following like the pattern of his lungs. I'm listening for bronchial breath sounds, bronchiovesicular and vesicular breath sounds. And I listen to front and back. I'm gonna have you scoot forward. I'm just gonna listen to your back. And then I'm doing the voice transmissions test. And so I'll ask you to say, I'm gonna test egophony, bronchophony, and whispered ventriloquy. So just follow what I tell you to do. Can you say E for me?
E for me.
No, just say E.
E.
Can you say 99?
99.
And then can you whisper 1, 2, 3? Good. So it should not sound clear when he whispers 1, 2, 3. Otherwise that means there's consolidation in his lungs. So I would listen all the way here. Look, I'm listening down to his lungs, front and back. It wasn't very good. And then I did the voice transmission test. Now I'm going to listen to his heart, and while I'm doing this, I'm inspecting his thorax and just looking for any abnormalities, any skin issues as well. The first spot I'm going to listen to is aortic, second intercostal on the right side, pulmonic, second intercostal on the left side, Erb's point, third, don't, and then forbs, tricuspid, excuse me, fourth, and then fifth and midclavicular intercostal space. Fifth intercostal midclavicular space is the mitral. And if it's a woman, sometimes you have to like lift up their breast and kind of get underneath there. Okay, and then that's good for cardiac. And I'm gonna have you lay down. Try and lay down this way. And I'm gonna listen for bowel sounds. I'm gonna look at his abdomen first, and then I'm going to auscultate next before I palpate. I'm listening for any bruise or aortic bruise. Listening in 4 quadrants. I would listen for 5 minutes before I declared like absent bowel sounds. And then I would percuss the liver and spleen. And I'd be standing on the right side of the patient, feeling for any masses. And then I'm going to do light and then deep palpation in the 9 regions. I would have the patient empty their bladder beforehand, so light would be with one hand, and then deep, I'm kind of just demonstrating. Then I would do deep palpitation, and like I said, the liver, I'm listening for aorta or masses on this right side. Okay, you can sit back in the chair now, I think. Okay, next I'm going to be doing, we'll do strength next. So push your arms out, good. Push your knees up at the same time, okay. Put your feet out, push on my hands, pull up, nose to your toes. That's kind of how you assess for Holman's-Stein. And if there's any pain back here in their calf or any warmness or swelling. And then clonus if their foot were to, if I let go, if it were to go back down after. And then also, okay, you can put your legs down. Then on all of extremities, I'm going to be looking for any edema, especially like in ankles. I'm going to be looking at the color, like how, if they're warm or cool. I'm going to be looking at cap refills on our toes. I take off their socks and look. Cap refill should be less than 3 seconds on all extremities. I'm also going to be checking pulses. So I already did the carotid, radial, extend your leg, popliteal, however you say it. Those are harder to fill, but, and then dorsal pedalis pulse. Okay, hold this up.
You found it.
Okay. And then I'm going to check deep tendon reflexes. I don't have like a little hammer thing that they use, so I'm just going to point them out. So your bicep one is going to be right here. You're going to see him flinch. Then the tricep would be here. Brachioradialis is going to be there. You would do this on all extremities, and then, or on this other arm, and then patellar, so we're going to hit here, and it like, yeah, extends out. And then Achilles, you kind of have to hold the foot back here, and then like hit right there, and their toes should, okay, gosh, so dramatic. The toes should flex up. Let me see if there's anything else I would assess. And I think that is everything.
Thanks for watching.